of the Republic of the Philippines, His Excellency Ferdinand R. Marcos Jr.
Pagbabago, dahil sa ito ay kinakailangan tayo na tulong-tulong, napaunlarin ang mahal natin bayan. Panahon na magbabago at ayos ang mga dapat ayusin. Dapat lang maging tungkulin.
Please remain standing for the singing of the Philippine National Anthem, be followed by invocation.
Bayang magiliw, pelas ng silanganan, hanap ng puso, sa dibdib mo'y buhay.
Noong panghihinang, duyan ka ng mag-ibig. Sa manlulupi, di ka masisingil.
Sa dagat ang tulong, sa simoy at sa langit mong lugaw, may dinang tula at awit sa paglayang minamahal.
Ang iskap ng watawat mo'y tagumpay na nagdidingding.
Ang bituin at araw niya kailan pa may
magdidiin.
ang mga tarnong dahil sa'yo.
Dear Heavenly Father, we thank you for gathering us all today in this important endeavor. We ask that you bestow your guidance and blessing upon each attendee. May we honor one another by keeping an open mind. May we voice our truth and listen with an open heart. Bless everyone present today, that each may be able to share his or her contributions and gifts. Grant good health and safety to loved ones left outside this room, and bestow peace and goodwill to all of us. We ask for your wisdom and grace to use our talents for the betterment of others. May the various activities related to this day be a success through your intervention. With gratitude, we offer this prayer in your name. Amen.
We may now be seated. Good morning. We are gathered here today for the signing ceremony of a memorandum of agreement between St. Luke's Medical Center, Global City, and PhilHealth, a partnership dedicated to ensuring that more patients can benefit from PhilHealth coverage while receiving world-class care. To formally begin our program, may we call on the President of St. Luke's Medical Center, Dr. Dennis P. Serrano, to deliver his opening remarks.
His Excellency, President Ferdinand R. Marcos Jr., President of the Republic of the Philippines, our distinguished officials from the national government, Department of Health Secretary, Dr. Edwin Mercado, DSWD Secretary, Mr. Rexlon Gatchalian, PhilHealth President and CEO, Dr. Beverly Ho, our colleagues from the national government, members of the St. Luke's Medical Center Board of Trustees and Executives, our doctors and the healthcare professionals, our valued partners and distinguished guests, ladies and gentlemen, good morning. It is my great pleasure to welcome all of you to St. Luke's Medical Center Global City today. We are deeply honored to have His Excellency President Ferdinand R. Marcos Jr. with us today as we mark this important milestone between St. Luke's Medical Center and the Philippine Health Insurance Corporation. The signing of our Memorandum of Understanding represents more than a partnership between the two institutions. It represents a shared commitment to our patients and to the Filipino people. At St. Luke's, we have always believed that access to healthcare should never require a compromise in the quality of care. Every patient deserves the opportunity to receive the right care from the right specialists, supported by advanced technology, expertise, and compassionate service. Through our partnership with PhilHealth, we hope to help make that opportunity available to more Filipinos. We recognize the vital role that PhilHealth plays in providing financial protection and expanding access to healthcare. And by working together, we can help eligible patients better understand and maximize their benefits while making their healthcare journey more seamless and responsive. The MOU we are signing today, witnessed by our President, is a meaningful step towards strengthening collaboration between government and the private healthcare sector. But beyond the document that we signed today, what matters most is what we do after the signing. How we translate this partnership into greater access and meaningful support to the people we serve. To our colleagues from PhilHealth, thank you for your trust and partnership and for your continued commitment to improving healthcare access in our country. To my St. Luke's family, thank you for continuing to uphold the standards of excellence, innovation, and compassion that define our institution. We look forward to building on this partnership and finding more ways to bring world-class care within reach of more Filipinos. Because ultimately, this is what our partnership is about. Same world-class care, greater access, one shared commitment to better health care for our people. Once again, welcome to St. Luke's Medical Center. Magandang umaga po and mabuhay.
Thank you, Dr. Serrano. To deliver his message, may we call on Department of Social Welfare and Development Secretary Rex T. Gatchalian.
President of the Republic of the Philippines, His Excellency Ferdinand R. Marcos Jr., Department of Health Secretary, Secretary Edwin Mercado, Philippine Health Insurance Corporation President and CEO Beverly Ho, St. Luke's Medical Center President and CEO Dennis Serrano, distinguished guests, ladies and gentlemen, good morning. It's my honor to join you today as we witness the ceremonial signing of the Memorandum of Understanding between PhilHealth and St. Luke's Medical Center. This partnership reflects a shared commitment to strengthening our healthcare system and guaranteeing that Filipino families can readily access essential services. For the DSWD, healthcare and social protection are deeply interconnected. When a family member falls seriously ill, the impact reaches far beyond medical expenses. Families often face sudden income loss, transportation costs, and financial strains that can quickly place them in severe distress. Through the Assistance to Individuals in Crisis Situation or AICS program, the DSWD provides financial aid to individuals and families experiencing medical crisis. We continuously strengthen our partnership with hospitals, drugstores, and other service providers to help ensure that assistance reaches those that need it. Concurrently, programs such as the Pantawid Pamilyang Pilipino or 4Ps help families meet essential health and nutrition needs, particularly among pregnant and lactating women. These efforts complement the work of PhilHealth and St. Luke's in providing health insurance coverage and advancing healthcare financing. Ultimately, universal healthcare is about making sure that every Filipino seeks medical attention without feeling that they have to face the burden, while our institution mandates may vary. Our missions remain the same: to safeguard Filipino families and help them overcome any challenge that threatens their well-being. The DSWD is proud to stand with PhilHealth, St. Luke's Medical Center, and our partners in government, and the private sector in pursuing this shared goal. May this collaboration fortify our healthcare and social protection systems, ensuring that Filipino families are protected, supported, and empowered to live healthier, more secured lives. Congratulations to the launch of this important partnership. Maraming salamat. Magandang umaga sa inyong lahat.
Thank you, Secretary Gatchalian. And now, to deliver her message, may we call on PhilHealth President and CEO, Dr. Beverly Lorraine Ho.
His Excellency President Ferdinand R. Marcos Jr., Secretary Edwin Mercado, Dr. Dennis Serrano, officers of St. Luke's Medical Center, Attorney Noel, Dr. Art de la Peña, Dr. Benjo Campomanes, officers of DOH and PhilHealth, colleagues, guests, and friends. Every year, an estimated 1.2 million families experience catastrophic spending. This financial strain creates a cycle of delayed care, worsening condition, higher cost, deepening the very reason care was avoided in the first place. This is precisely the cycle the UHC law was designed to break, to guarantee every Filipino access to needed care, not when they can afford it, not when it's critical, but when they need it. Specifically, the UHC Act mandates that Filipinos should be afforded quality care at zero co-payment at basic ward accommodations. St. Luke's Medical Center is helping us realize this promise today. St. Luke's has long been a name Filipinos associate with the very best of medicine this country has to offer, a level of care that rivals any hospital in the region. Under Dr. Serrano's leadership, St. Luke's is stepping up its role in UHC in the country, extending care to every Filipino brought to its doors. In the same way that PhilHealth is not reserved for any segment, so does quality care provided by an apex hospital like St. Luke's. We laud you for your compassion and institutional conviction as reflected in your core values. In the coming months, we aim to implement a pilot program on global budget where payments can be front-loaded to hospitals that are aligned with our thrust to further expand no-balance billing options and predictable co-payment for Filipinos. We are confident that St. Luke's will aid us in the design of such program through active participation in cost analysis and CF5 shadow billing initiatives, as well as quality and outcomes monitoring. When the President started his term, 45% of out-of-pocket payments were shouldered by households. In 2025, by end of 2025, it's already down to 41%. Malayo na, pero marami pa tayong pwedeng gawin. So when multiple institutions work together towards the same mission of UHC, walang imposible, especially with a strong political will behind us. May this partnership be just the beginning and that the rest of St. Luke's network, as well as other private hospitals, follow suit and find this partnership worth emulating. To Dr. Serrano and every physician, nurse, administrator in this hospital, maraming salamat po and sama-sama po natin iakyat ang antas ng kalusugan in this country. And we hold ourselves to our values of mabilis, patas, and mapagkakatiwalaan. Thank you very much.
Thank you, Dr. Ho. And now, we shall witness the signing of the Memorandum of Agreement between St. Luke's Medical Center, Global City, and PhilHealth. May we invite the designated signatories to please proceed to the front of the stage. For St. Luke's Medical Center, Global City, may we invite SLMC President and CEO, Dr. Dennis P. Serrano, and Senior Vice President and SLMC Global City Medical Director, Dr. Anthony R. Perez. For PhilHealth, may we call on PhilHealth President and CEO, Dr. Beverly Lorraine Ho, and Senior Vice President, Health Finance Policy Sector, Dr. Carlo Panelo. May we also request the President to proceed in front to witness the signing ceremony. A round of applause, everyone. Congratulations to St. Luke's Medical Center, Global City, and PhilHealth. At this point, may we call on Health Secretary Edwin M. Mercado to introduce our keynote speaker.
Ladies and gentlemen, the President of the Republic of the Philippines, His Excellency Ferdinand R. Marcos Jr.
Thank you very much to our Health Secretary, Secretary Edwin Mercado, DSWD Secretary, Secretary Rex Gatchalian, PhilHealth President and CEO, Beverly Lorraine Ho, St. Luke's Medical Center President and CEO, Dr. Dennis Serrano, SLMC Vice Chairman Attorney Cirilo Noel, Health Equity Research Foundation President and CEO, Dr. Arturo de la Peña, St. Luke's Foundation President and CEO, Dr. Benjo Campomanes, fellow workers in government, ladies and gentlemen, good morning. This very simple ceremony belies the importance of what we mark today because we mark a partnership that strengthens our shared commitment to ensuring that Filipino patients have easier access to quality and affordable healthcare services and benefits that they all deserve. Getting sick is difficult enough, but for many families, the bigger worry is how to afford the treatment that they need. Walang pinipiling tao ang sakit. Anyone can suddenly face a medical emergency that requires immediate treatment or specialized care. Choosing a private hospital like St. Luke does not necessarily mean that the patient or family can readily afford the cost of treatment. More often than not, patients turn to these institutions because they offer specialized expertise, advanced equipment, and complex treatments that their medical conditions require. This administration remains committed to making quality healthcare accessible and affordable to more Filipinos. PhilHealth is a key part of that commitment. PhilHealth has been instrumental in protecting families from the financial burdens that come with illness and with treatment. But we in government cannot do this alone. And that is why we welcome the private sector's participation in helping us deliver better health outcomes and provide much needed relief to our patients and their families. Today's signing of the Memorandum of Agreement is an example of that cooperation. The Memorandum of Agreement between PhilHealth and St. Luke's Medical Center Global City reflects a shared commitment to strengthen the implementation of the no co-payment policy and to support the government's universal healthcare agenda. By joining this effort, St. Luke's also sends an important message that quality care in leading private hospitals can be made more accessible to qualified PhilHealth members, and that both government and the private sector have a role in making universal healthcare work. For a patient, this can mean less time worrying about whether treatment is within reach, more time focusing on getting better. For a family, it can mean relief from the fear that one medical emergency can consume their savings or force them to choose between treatment and other basic needs. And for our healthcare system, it means bringing together the strengths of the public and private sectors to better serve more Filipinos. Beyond this partnership, we are also strengthening other government programs that help reduce the financial burden of medical care. Pinabababa natin ang sariling gastos ng pasyente sa pamamagitan ng zero balance billing o ZBB sa mga DOH hospital. Meron din tayong medical assistance to indigent and financial incapacitated patients na ginawa pa nating electronic ang MAIP, gaya ng nasabi ko noong nakaraang sauna. Madali nang makakuha ng tulong sa mga DOH hospital dahil mas kaunti na ang kinakailangan dokumento at maaari na itong gawing online. Pinapalawak din natin ang PhilHealth Yakap upang mailapit sa bawat Pilipino ang libreng konsultasyon, laboratory test at cancer screening. Sa cloud din nito ang mga kinakailangang gamot sa ilalim ng Guaranteed and Accessible Medications for Outpatient Treatment o yung GAMOT program. Kasabay nito, patuloy tayong nagtatayo ng mga bukas center upang mailapit sa mga komunidad ang urgent care, ang outpatient services at iba pang mga serbisyong medikal nang hindi kailangang bumiyahe sa malalayong ospital pa. Malinaw ang ating hangarin. Hindi dapat maging hadlang ang kakulangan sa pera para makakuha ng kinakailangan atensyong medikal. It is a simple and universal belief that we must all uphold. So as we improve how we finance healthcare, we must make sure that our reforms remain compassionate and people-oriented. To PhilHealth and to St. Luke's, thank you for coming together in the service of our people. Continue to ensure that our healthcare systems become more responsive and affordable for Filipino families, especially those who are most in need. Continue removing the financial, geographic, and institutional barriers that keep patients from getting the assistance that they need. We encourage more hospitals across the country to support PhilHealth in advancing universal healthcare by embracing the no copayment policy. Together, let us ensure that no Filipino is denied the care that they need only because of financial hardship. Tandaan, ang sistema dapat ang tumutulong sa pasyente. Hindi dapat sila mahirapang sumunod sa prosesong lalo lamang nagpapabigat sa kanilang buhay. Thank you all very much. Congratulations for this very, very important day. And we look to the future for this continuing cooperation between St. Luke's, PhilHealth, between the private sector and the public sector in healthcare. Mabuhay kayo at mabuhay ang bagong Pilipinas.
Thank you, Mr. President. And now, may we request the President to kindly grant us a photo opportunity. May we call on stage the heads of the Department of Health, Department of Social Welfare and Development, and PhilHealth. St. Luke's core team, please stand by. Thank you. Please exit to your right. St. Luke's core team, you may now proceed on stage. St. Luke's medical heads, please stand by. Thank you. Please exit to your right. And finally, St. Luke's medical heads, you may now proceed on stage. you, Mr. President, for granting us a photo opportunity. That concludes our program. Thank you, Mr. President, for gracing the signing ceremony between St. Luke's Medical Center, Global City, and PhilHealth, strengthening partnership for the implementation of benefit packages and policies.